Hi, good morning. Welcome to Business. My name is Darryl Kwao. The Teachers and Educational Workers Union is calling on government to review payment ratios for teaching and non-teaching staff. The ratio for disbursement of money for the two categories of workers presently stands at 80 to 20% for non-teachers and teachers as well. Now, the leadership says introduction of free senior high school and double track system has increased the burden on both without corresponding compensation. TEU Chairman Peter Lumo says government is in addition paying only 20% of overtime work done, which is demoralizing. He was addressing the 12th Quadrennial National Delegates Conference and 60th anniversary celebration of TEU in Kumasi. Prince Apia has more in this report.
Educational Sector Performance Report in 2018 confirms that secondary education recorded enrollment growth from 758,465 to 1,008,237 in 2016. Thanks to free senior high school and double track system, the numbers have increased almost by an additional 100,000 a year since 2017-2018 academic year. This has increased the burden on both teaching and non-teaching staff of senior high schools. However, an intervention money released to the schools is shared 80 to 20 between teaching and non-teaching staff respectively. Acting General Secretary of TEU, Mark Dencha-Kranche, says this is unfair.
It's a matter of urgency to recruit more non-teaching staff to lessen the burden on the current staff. We are also calling on government to look again into the sharing of intervention money released to the schools and give the non-teaching staff what is right. What was given us the last time in the ratio of 80 to 20. I will believe that we deserve more than that. If it cannot be 50-50, the worst case scenario should be 60-40.
The theme for the conference is 60 years of TEU's contribution to the development of equitable, inclusive and quality education delivery in Ghana. Chairman of TEU, Peter Lumo, wants serious attention given to general service conditions for TEU members.
How can you tell me that my conditions of service, I should not work overtime more than 75% of my salary? Today, some people are saying that no matter the hours of work I do, they will pay only 20% as overtime. Hello? Please, let's go to the table. If you want us to work up to 20%, we will work 20% and go home. We will not work more than the amount of 20% and you insist that we should work. You negotiate with me, you tell me how much you pay me, I do overtime. You don't impose any amount on me and expect me to work overtime.
Other issues under discussion at the conference include critical support program, abolition of GES SIC insurance scheme, and the new university bill. Deputy Employment Minister Bright Rekubrobe says the issues will receive attention from relevant authorities. The conference ends on Friday with election of new executives to steer the affairs of the union for the next 4 years. Prince Apia reporting.
Now, the head of National Quality Management Unit at the Ministry of Health, Dr. Ernest Kunedu-Esiedu, has revealed that government has taken steps to offset the debts owed service providers under the National Health Insurance Scheme. He made this known after a ceremony to crown the 10th anniversary of Advocate Healthcare here in Accra. Here's Philip Anker's report.
The National Health Insurance Scheme, instituted as a means to help citizens have access to affordable healthcare delivery in the country, has experienced some challenges when it comes to paying off arrears owed service providers, with some threatening to revert to cash and carry system. The recent one is the Ghana Medical Association, which noted the authority owes hospitals, both public and private, services rendered from September 2018 to May 2019. Dr. Ernest Kunedu-Esiedu disclosed some of these monies have already been paid.
Yes, in the last couple of weeks, there's a lot of reimbursement that has gone on within the healthcare setting. And I dare to say that I also attended the Christian Health Association of Ghana conference last week in Tamale, and the minister emphatically mentioned that Ministry of Finance has released a lot of funds for them to reimburse the facilities. I wouldn't be able to talk about the percentage, but I know that if you even contact some of the facilities, they have received a lot of money currently, So in the last couple of weeks, I know that facilities have been reimbursed. I wouldn't be able to say this, I think.
He also revealed that the Health Insurance Authority is taking steps to prevent some unscrupulous people from making false claims.
One of the things to do to curb stealing, basically, within the health system is the fact that when you have received a service in a facility, you may even receive a text message to find out, have you received health service at this particular point? And then you can answer yes or no. And that is also helping us to track thieves within the system in the health facilities, where patients who have not even accessed facilities, their numbers are keyed into the system and then also being used for reimbursement.
Chief Executive Officer of Advocate Healthcare, Joseph Nimako Boateng, called on the government to take a holistic look at the dental health sector.
We're training dentists in 2 dental schools. Quite a number of dentists are being produced, which is a good step, but we need to resource them to be able to work. So there's no point posting somebody to a place where there's no chair, there's nothing to use to provide the service. So we need to actually resource the dentists being trained to work. The other thing is that they don't work in isolation. They work with paradental staff. So we need to train dental nurses. We need to train dental equipment technicians, because when the equipment we use break down, sometimes it's difficult to find people to repair them for us. These are some of the bottlenecks we face. So if the government is training dentists, there should be a holistic approach to train all the other supporting people.
For JoyNews, Philip Ankresh reports.